Chapter 9. Disinfection. Introduction. While the ultimate goal for surgical instruments is sterilization, which is defined as the complete elimination of all microbial life, not every item in the healthcare setting requires such a rigorous process. It is vital to understand that disinfection is defined specifically as the destruction of nearly all pathogenic microorganisms on an inanimate surface. The key distinction between disinfection and sterilization lies in the destruction of bacterial spores. Sterilization kills all microorganisms, including bacterial spores. Disinfection, however, kills most pathogenic microorganisms but lacks the ability to kill large numbers of bacterial spores. The level of disinfection required for a specific device is determined by the risk of infection associated with its use, a concept formalized by the Spaulding classification system. Introduction to disinfectants and safety. A disinfectant is a chemical agent used on inanimate objects, such as medical devices, floors, and walls, to kill microorganisms. It is crucial for sterile processing technicians to distinguish clearly between disinfectants and antiseptics. Disinfectants are used on inanimate objects like tables and instruments because they are generally too toxic for use on human skin. Antiseptics are used on living tissue, such as skin, to inhibit the growth of microorganisms. Common examples of antiseptics include alcohol and iodine used for surgical prep. In the sterile processing department, disinfectants are categorized by their strength or level of kill capability. These categories are low level, intermediate level, and high level. The effectiveness of these chemicals depends on several critical factors. These include the number of microbes present, known as bioburden, the hardness of the water, the temperature of the solution, and, most importantly, the contact time. Contact time refers to how long the item remains wet with the chemical to ensure efficacy. The Spaulding classification system. Developed by Dr. Earl Spaulding in 1968, the Spaulding classification system is the universal framework used by healthcare facilities and regulatory agencies, such as the FDA and CDC, to determine the appropriate method of processing for a medical device. The system divides medical devices into 3 categories based on the risk of infection involved in their use. These categories are critical, semi-critical, and non-critical. The first category is critical items. These are devices that enter sterile tissue or the vascular system, meaning the bloodstream. The risk associated with these items is high. If these items are contaminated with any microorganisms, including spores, the risk of infection is extreme. Therefore, the processing requirement for critical items is sterilization. Examples of critical items include surgical instruments, cardiac catheters, implants, needles, and invasive probes. The second category is semi-critical items. These are devices that come in contact with mucous membranes, such as inside the mouth, nose, rectum, or vagina, or non-intact skin, such as burns or cuts. The risk here is considered moderate. Mucous membranes resist bacterial spores but are susceptible to other microorganisms. The processing requirement for these items is high-level disinfection. It is important to note that sterilization is preferred if the device is heat-stable, but high-level disinfection is the minimum standard. Examples include flexible endoscopes like colonoscopes and gastroscopes, laryngoscope blades, anesthesia breathing circuits, and vaginal specula. The third category is non-critical items. These are devices that come in contact with intact skin only. The risk is low because intact skin is an effective barrier against most microorganisms. The processing requirement is low-level or intermediate-level disinfection. Examples include blood pressure cuffs, stethoscopes, bedpans, pulse oximeters, and patient transport tables. When in doubt about how to process an item, the technician should ask where in the body the item touches. The answer determines the classification. Safety protocols and work practices. Disinfectants are powerful chemicals designed specifically to kill living cells. Consequently, they can be extremely hazardous to human health if mishandled. Therefore, strict safety protocols must be followed during manual disinfection to protect the technician. The first critical element is the work area setup. The area where chemical disinfection takes place must be well ventilated to manage toxic fumes. Many high-level disinfectants, such as glutaraldehyde, emit vapors that can cause respiratory irritation or trigger asthma. To mitigate this risk, the room generally requires a minimum of 10 air exchanges per hour. Furthermore, venting systems, such as fume hoods or local exhaust ventilation, should be used to actively pull vapors away from the technician's breathing zone. In terms of layout, the disinfection area should be physically separate from the cleaning area to prevent the recontamination of disinfected items. Additionally, safety requires that hand wash stations and emergency eye wash units must be immediately accessible in case of accidental exposure. The second element of safety is proper labeling. There are two types of containers to consider. First, the primary containers, which are the original bottles from the manufacturer, must have a legible label detailing safety warnings and instructions. Second, technicians often pour chemicals into secondary containers, such as a basin or spray bottle. If this occurs, that secondary container must be labeled with 4 specific pieces of information: the chemical name, the concentration, the hazard warnings such as corrosive or flammable, and the expiration date if applicable. The third element is preparation instructions. Some high-level disinfectants are not ready to use right out of the bottle. They require activation. These products often come in 2 parts, a solution and an activator powder or liquid, that must be mixed before use. Once activated or opened, the solution has a specific shelf life, for example, 14 days or 28 days. To track this, the technician must write 2 distinct dates on the container. The first is the date opened or activated. The second is the expiration date. It is a strict rule that the solution must be discarded on this expiration date, even if it has not been used. The final and perhaps most critical variable in the disinfection process is contact. Contact time, often referred to as wet time, is defined as the amount of time the disinfectant must remain wet on the surface of the device to be effective. This is an absolute requirement. If the label instructs a contact time of 10 minutes, the device must stay wet for the full 10 minutes. If the device dries after only 5 minutes, the process has failed, and the timing must be restarted from 0. For items being soaked, this means the entire device must be completely submerged in the solution. Special attention must be paid to hollow lumens, which must be filled with the liquid to ensure no air bubbles prevent the chemical from contacting the inner surfaces. Types of disinfectants. Low and intermediate level. Before discussing high-level disinfectants for instruments, we must identify the chemicals used for environmental surfaces and non-critical items. First are quaternary ammonium compounds, commonly known as quats. These are low-level disinfectants effective against gram-negative and gram-positive bacteria but ineffective against spores. They are often used on dietary surfaces and patient care equipment. Technicians must be aware of cotton depletion, a phenomenon where cotton rags absorb the active chemical, rendering the disinfectant ineffective. Therefore, special wipes or synthetic cloths should be used. Second are phenolics. These are intermediate-level disinfectants used primarily for environmental surfaces like walls and floors. However, they leave a residue and should not be used on equipment that touches skin or in nursery areas, as they can cause hyperbilirubinemia in infants. Third is alcohol. Isopropyl alcohol, usually at a concentration of 70%, is a common intermediate-level disinfectant. While effective, its major limitation is rapid evaporation. It dries quickly, making it difficult to maintain the required wet contact time, often 5 to 10 minutes, which limits its use for large surfaces. Types of disinfectants. High level. Now we address the operational workflow for high-level disinfection. This process is mandatory for semi-critical items, which are devices touching mucous membranes. By definition, high-level disinfection kills all vegetative bacteria, viruses, fungi, and mycobacteria, which is the organism that causes tuberculosis, but it may not kill high numbers of bacterial spores. The high-level disinfection process consists of 4 distinct steps that must be followed in order. Step 1. Cleaning. The device must be thoroughly cleaned and, crucially, dried before it is placed into the disinfectant. This drying step is vital because excess water on the device will dilute the disinfectant solution, reducing its concentration and effectiveness. Step 2. Immersion. The device must be completely immersed in the solution for the required contact time. Step 3. Rinsing. After disinfection, the device must be rinsed thoroughly. However, you cannot use ordinary tap water, as it may contain microorganisms that could recontaminate the device. Instead, sterile water or extensively treated water must be used to remove toxic chemical residues. Step 4. Drying. The channels of the device must be purged with air and then dried with alcohol. The alcohol mixes with any remaining water and evaporates quickly, preventing water stagnation and bacterial regrowth during storage. To ensure the chemical solution remains potent enough to kill microbes during this process, we rely on minimum effective concentration, or MEC, testing. High-level disinfection solutions degrade over time and with repeated use. Therefore, the solution must be tested using a specific chemical test strip before each use. It is critical to use the correct strip for the specific chemical. For instance, you cannot use a glutaraldehyde strip for testing OPA. If the strip does not show the passing color, the solution must be discarded immediately, even if the expiration date has not yet passed. Common high-level disinfectants. There are several types of chemicals approved by the FDA for use as high-level disinfectants, each with unique properties. Number 1. Glutaraldehyde. This agent is commonly used for semi-critical devices like endoscopes and other heat-sensitive items. Glutaraldehyde typically comes in 2 separate containers, an acidic solution and an alkaline activator. These must be mixed by the technician before use. Once activated, the solution usually changes color, often to green, to indicate it is ready. Once activated, glutaraldehyde has a specific use life, typically ranging from 14 to 28 days depending on the brand, and this date must be marked on the container. The contact time for manual soaking varies significantly based on temperature, often ranging from 20 to 90 minutes, so consulting the instructions for use is essential. Regarding safety, glutaraldehyde has a pungent, irritating odor and is a known respiratory irritant. Strict ventilation is required. Furthermore, standard exam gloves are often insufficient. Technicians should wear butyl rubber gloves to prevent the chemical from absorbing through the glove material and reaching the skin. Number 2. Orthothialdehyde, or OPA. OPA has become a preferred alternative to glutaraldehyde in many facilities because it is faster and has significantly less odor. Unlike glutaraldehyde, OPA requires no activation. It comes ready to use right out of the bottle. Once poured into a basin, it typically has a use life of 14 days. The contact time is also much faster, often requiring only 12 minutes at room temperature for manual soaking, though technicians must always verify the specific instructions for use. OPA possesses a unique property that serves as a diagnostic tool for sterile processing technicians. It stains proteins a blue or gray color. If an instrument is removed from an OPA soak and exhibits blue stains, it indicates that protein soil was left on the device. This means the item was not clean. Consequently, the disinfection process is considered a failure, and the item must be returned to the cleaning area to be re-cleaned. Number 3. Hydrogen peroxide. It is important to clarify that this is not the generic brown bottle solution found in drugstores. This is a specific medical-grade formulation, often at a concentration of 7.5%. While effective, technicians must be aware of material compatibility issues. Hydrogen peroxide can be corrosive to certain metals, specifically brass, copper, and zinc, and may damage the functional ends of endoscopes if not formulated correctly for those specific devices. Number 4. Peracetic acid, or PAA. This is a strong oxidizer, essentially a mixture of vinegar and hydrogen peroxide. It is most frequently used inside automated machines rather than for manual soaking. PAA is extremely efficient and fast-acting, often achieving disinfection in 5-minute cycles. However, because it is an acid, it is highly corrosive to instruments. To prevent damage, the processing machine typically adds buffering chemicals to neutralize the acid during the cycle. Mechanical disinfection processes. This discussion of chemicals leads us directly to the mechanical methods of disinfection. First, we must mention thermal disinfection. Not all disinfection requires chemicals. Washer disinfectors, used in the decontamination area, utilize hot water to achieve intermediate to high-level disinfection. This process relies on heat to kill microorganisms and is preferred for heat-tolerant instruments. Similarly, pasteurizers are older devices that use hot water, typically 160 to 170 degrees Fahrenheit, for approximately 30 minutes to disinfect respiratory therapy and anesthesia equipment. Second, for endoscopes, we use the automated endoscope reprocessor, or AER. While manual soaking is acceptable, AERs are the preferred method in modern facilities because they significantly reduce human error and minimize staff exposure to toxic chemicals. These machines offer several key advantages. First, they provide standardization, ensuring that the disinfectant contacts all surfaces for the exact required time and temperature during every single cycle. Second, AERs are sealed systems that control vapors, protecting staff from inhaling fumes. Third, they utilize bacterial retentive filters to ensure the rinse water does not recontaminate the clean scope. However, operating an AER requires strict adherence to guidelines. The most critical rule is that an AER does not replace manual cleaning. The scope must still be thoroughly brushed and flushed at the sink before being placed in the machine. If soil remains on the device, the AER cannot disinfect it. Furthermore, the technician must physically connect specific hookups from the machine to the scope's internal channels, such as the suction, air water, and biopsy channels. If a connector is loose or missing, the disinfectant will not flow through that channel, and the device will remain contaminated. Many modern AERs also perform an automated leak test at the start of the cycle to ensure the integrity of the scope before processing begins. Documentation and record keeping. Once the disinfection process, whether manual or automated, is complete, we arrive at the final critical component of the workflow, documentation. In high-level disinfection, accurate record keeping is not just a procedural formality. It is a strict legal and safety requirement. The logic is simple yet severe. If a patient develops an infection, such as hepatitis or HIV, after an endoscopy procedure, the healthcare facility must be able to trace exactly which scope was used on that patient and prove, with evidence, that it was processed correctly. To satisfy this requirement, every facility maintains a logbook, which may be electronic or paper-based. This log must contain 6 specific data points for every single cycle. 1. The date and time of the disinfection process. 2. The patient information, typically the patient's name or medical record number, often abbreviated as MRN, to unequivocally link the scope to the patient. 3. The device identification, such as the serial number or specific ID of the endoscope. 4. The MEC test result, which is the confirmation that the chemical passed the minimum effective concentration test. 5. The cycle parameters, confirming that the required temperature and contact time were met. For automated systems, this is often the printout from the machine. 6. The technician ID, which is the signature or initials of the person who performed the task. The ultimate goal of this documentation is traceability. You must be able to track a scope backwards from the patient, to the automated endoscope reprocessor, to the technician, and even to the specific lot number of the chemical used. Conclusion. As we conclude our study of Chapter 9, let us review the core principles we have established. Disinfection serves as a critical defense in infection prevention, acting as the bridge between simple cleaning and absolute sterilization. While it does not kill bacterial spores, it destroys the pathogens most likely to cause infection on semi-critical and non-critical devices. Success in this field relies entirely on the technician's ability to apply the Spalding classification system. Knowing whether a device touches intact skin, mucous membranes, or sterile tissue is the deciding factor in whether it needs low-level disinfection, high-level disinfection, or sterilization. Furthermore, the safe handling of powerful chemicals like glutaraldehyde and OPA protects not only the patient but also the technician. Finally, we must solidify our understanding of the terminology used in this chapter. You must distinguish between two similar-sounding terms regarding the effects of chemicals. The first is bactericidal. The suffix cidal means to kill. Therefore, a bactericidal process is one that actively kills bacteria. The second term is bacteriostatic. The suffix static means to stop or keep the same. A bacteriostatic process inhibits or slows down the growth of bacteria but does not necessarily kill them. Additionally, remember that high-level disinfection kills all vegetative microorganisms, mycobacterium, and viruses, but only some bacterial spores, whereas low-level disinfection kills vegetative bacteria and some fungi but is not effective against spores. This concludes our study of Chapter 9.